Dear doctors, we all know most of the cardiovascular diseases are of lifestyle origin. Latest study shows lifestyle of the parents, especially the diet and toxin exposure, including medications of pregnant women, can lead to congenital heart disease or make the child predisposed to cardiovascular diseases in adult life. Sedentary life and calorie nutrient deficient or nutrient excess diet leading to change in the body composition, fat mass lean mass ratio and omega 3 to 6 ratio at cellular level, toxin exposure of varying nature and associated derailment in immune and hormone functions of the body is the root cause of cardiovascular diseases, including hypertension, high cholesterol, triglycerides, atherosclerosis, vessel blocks, heart attack, stroke, heart failure, etc. Lifestyle disease usually comes not alone, but as a disease package or syndrome like metabolic syndrome comprising obesity, diabetes, high blood pressure, high cholesterol, high triglyceride, fatty liver, and finally ending up as autoimmune diseases, cancers, organ failures like heart failure, kidney failure, liver failure, etc. Correcting the derailed lifestyle, optimizing body weight and body composition at cell level are the safest and the most effective treatment method for prevention and treatment of cardiovascular diseases, including hypertension, elevated cholesterol, triglycerides, atherosclerosis, vessel block, arrhythmias, heart disease, heart attack, stroke, etc. Other lifestyle diseases like diabetes, autoimmune disease, allergic disorders, emotional disturbances, and drugs we take as medication to treat these diseases also can act as toxin to heart and blood vessels and aggravate the disease process. But in general, we doctors ignore the root cause, lifestyle factors, nutritional derailments, low activity level, and excess fat accumulated in the body and try to treat each symptom or sign like high blood pressure, cholesterol, triglyceride, arrhythmias, aches and pains, etc. with one or more drugs. Anything other than a nutrient, including drugs taken as medication or a nutrient in excess quantity, is considered a toxin by the body and will increase the workload of the immune system and excretory organs of the body. In many cases, medication itself creates further imbalances in the immune system and hormonal activities and promotes weight gain, especially the medications used for the treatment of diabetes, psychiatric disorders, autoimmune diseases, cancer, etc., and further aggravate the situation. It is easy to diagnose the most important predisposing factor for cardiovascular disease, overweight and obesity. Even though we diagnose overweight or obesity in a patient of ours or a close relative or in ourselves or even in our own children, we ignore it. When our BP increases to 130/80, we start an antihypertensive, or when we are diagnosed with elevated cholesterol or triglyceride, we start statins. And we may add a low-dose aspirin as a blood thinner to escape from heart attack and stroke. When this progresses to atherosclerosis and vessel block, we try to overcome with angioplasty or bypass. The list of drugs we use for ourselves and prescribe to our patient often to take lifelong damages our blood vessels, weakens our immune system, derails our hormone functions, and damages our excretory organs like liver and kidney. If we adopt and promote lifestyle corrections, we can prevent the occurrence of lifestyle diseases. If diagnosed, this can help in treating it and curing it and prevent its recurrence. In general, when a doctor himself or herself is ignoring his or her health, becoming overweight or obese, it is against the spirit of his or her profession and responsibilities. When treating the disease state like diabetes, hypothyroidism, arthritis, hypertension, high cholesterol, etc., we start taking drugs regularly rather than correcting the derailed lifestyle. The excuse is lack of time for activity and finding healthy food due to the busy work schedule. If the doctor himself is finding solace in drug rather than the root cause correction, how can he or she motivate the patient for correcting the root cause, which is the lifestyle? Such doctors will do the same for their patients too. Prescribe drugs and motivate them to take it regularly and treat complications with more drugs and more surgical interventions rather than promoting lifestyle corrections. In our medical education, we give importance on studying the signs and symptoms of diseases and investigation procedures to reach a diagnosis. We learn how to use drugs or surgery. The most important aspect of health, nutrition, physical activity, body composition, lean mass fat mass ratio, etc., have been ignored in the curriculum and in the practice of modern medical doctors, which is the reason for the increased incidence of obesity and associated health issues, which reduces the productivity of the individual, quality of life, and is a social and economic burden on the family and the nation. Now, with increased understanding on the root cause of many chronic diseases, as lifestyle factors and the safety, effectiveness, and economy of lifestyle correction for prevention, treatment, and prevention of recurrence of lifestyle diseases over drugs and surgical intervention, we should incorporate lifestyle correction as a treatment method in our modern medicine curriculum and practice. This can make a revolution in the health of the people. Modern healthcare sector will be providing real lifelong support and is crucial for the future of our nation's large and young population. Cell activation program is a clinically monitored lifestyle correction program developed based on the observations of the Greek physician Hippocrates, the father of modern medicine, who is attributed to the words, "If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health." Considering the modern industrialized living, special importance has been given in reducing the toxin entering the body as preservatives, colors, tastemakers, etc. in food, body care, and cosmetic support and care. We doctors should become an example for the public by maintaining optimal lifestyle, maintaining optimal body weight, and optimal health without chronic medication for controlling lifestyle diseases. Then only we can motivate the public and our patient to correct their lifestyle, protect them from cardiovascular and other lifestyle related diseases, and make our nation and the world at large healthy and prosperous.